Okay, let's talk about something that can feel like just a simple leg cramp, but can spiral into a major medical emergency. It's a silent threat, and today we're pulling back the curtain on deep vein thrombosis and its very dangerous travel buddy, pulmonary embolism.
And look, let's just get straight to why this is so important. This isn't some rare out there condition. We're talking about a major cause of death in hospitals. And here's the key word: preventable. That one word is everything. It means that knowing what's going on, well, that's half the battle right there. So the fancy medical term for the whole shebang is venous thromboembolism, or VTE for short. The easiest way to think about it is that VTE is the big umbrella name, and under that umbrella, you've got two conditions that are basically two acts in the same play. And this, right here, tells the entire story in a single glance. See, the problem starts down in the leg, where a blood clot forms in one of the deep veins. That's your DVT. But the real danger, is when a piece of that clot breaks off, travels up through your bloodstream, and slams into your lungs. That's the pulmonary embolism, the PE. It's a domino effect, and you have to understand the first domino to stop the last one from falling.
So that brings up a pretty big question, right? How does a clot like this even form in the first place? Well, it's not just random bad luck. Turns out there's a kind of recipe for it, a perfect storm of conditions that have to come together. For more than 100 years, doctors have used this really elegant concept to explain it. It's called Virchow's triad. It sounds complicated, but it's actually a super simple way to boil down the cause of a clot to just three main ingredients. First up, you've got venous stasis. Just picture a river that's moving super slow. The water gets all sludgy and stagnant, right? That's exactly what happens to your blood when you're not moving around. Second, endothelial injury. This is basically damage to the inside lining of your vein, like a little scratch on the inside of a pipe that gives stuff a place to catch on. And third, hypercoagulability. All that means is your blood is stickier than normal, more likely to clump up. Now, you don't always need all three at once, but when they start to overlap, that's when the risk really shoots up.
So, okay, that's the theory. But what does Virchow's triad actually look like in the real world? Well, each of these situations you see here is something that can trigger one or even all three parts of that triad, creating those perfect conditions for a clot.
And here are some of the biggest culprits. Being immobile, stuck on a long flight or laid up in a hospital bed. That causes that slow, stagnant blood flow we talked about. Major surgery? That's a real double whammy, because you've got the immobility plus potential damage to veins. Then there are things to make the blood itself stickier, like certain cancers or even some oral contraceptives. It's pretty easy to see how these things can start to stack up against you.
Okay, so now we know the how. We've got our clot. Let's trace its journey, because this is where we see how a problem that seems contained to just one leg can quickly escalate into a full-blown, life-threatening crisis in the lungs.
So how would you even know if this is happening? Well, your body is usually pretty good about sending out some warning flares, and they're coming right from your leg. The trick is just knowing what to look for.
The classic signs are pain and swelling, and here's the huge giveaway. It's almost always just in one leg, not both. The area might also get red, feel warm to the touch, and be really tender. Just think about it: swelling, soreness, maybe some skin discoloration, and a weird feeling of warmth.
But here's the thing. The real immediate danger isn't just the ache in your leg. The truly life-threatening part happens if a piece of that clot decides to break off and go for a ride. So what happens then? This right here, this is the critical moment. A piece of that clot breaks loose, and now it's got a new name, an embolus. It's officially a ticking time bomb, floating free in your bloodstream, heading straight for your heart and ultimately your lungs.
And its final destination is almost always the lungs. When that embolus gets lodged in one of those pulmonary arteries, that's it. That's a pulmonary embolism. It's an absolute medical emergency because it acts like a dam, suddenly stopping blood from getting the oxygen it needs and putting a massive, sudden strain on the heart. This is the absolute worst-case scenario of an untreated DVT.
Now, I know that all sounds incredibly scary, but here's the good news. Doctors have a really clear, very effective game plan for diagnosing a DVT before it ever gets to that point. Let's walk through how they do it.
It's really a process of elimination, and it gets more specific with each step. They start by just looking at the situation to figure out how likely a DVT even is. From there, they might use a simple blood test to help rule it out. And if they need a final, definitive answer, they bring in the imaging to actually see the clot. That first step is usually the simple checklist called the well score. Think of it as a way for a doctor to quickly add up points for all the risk factors and symptoms.
Like, have you had recent surgery? Is one calf much more swollen than the other? It gives them a quick probability score.
And the result is really straightforward. A score of 2 or more basically says, yeah, a DVT is pretty likely here, and that person is probably going straight to get an ultrasound. But if the score is lower, it's less likely, and the doctor might use a different test to confirm it's not a DVT. It's all about guiding them to the most logical next step.
Okay, so let's say the tests come back and a DVT is confirmed. What now? Well, this is the most important part, what we can actually do about it, and more importantly, how we can try to prevent it from ever happening at all.
The main goal with treatment isn't to go in and, blast the existing clot to pieces. It's actually to stop it from getting any bigger and to prevent any new clots from forming. And you do that with anticoagulants, which you probably know as blood thinners. They basically buy your body the time it needs to dissolve the clot on its own. And the options are pretty straightforward these days, from injections to simple pills you take by mouth.
And that brings us all the way back to the beginning. We started this whole conversation by saying this is a preventable problem. And we learned that one of the absolute key ingredients in the recipe for a clot is just being still, letting that blood pool. So the final thought I want to leave you with is a question you can ask yourself, especially if you've been sitting at a desk all day or you're on a long trip. Knowing what you know now, isn't it time to get up and move?